You're listening to episode 193, my thoughts and takeaways as a child life specialist who went to the American Academy of Pediatrics conference for the first time. Hello, my friends. Welcome to Child Life on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. Hello, my friends. You have got yourself a solo episode today, which means I do not have a guest with me, so you're just stuck with Katie Taylor here back home in my Austin office. Just honestly so thrilled to be home. It has been a crazy past 8 days of travel for me, which is not typical. I had the opportunity at the beginning of last week to go to Chicago, and I was actually brought there by a pharmaceutical company who has clinicians who they are sending in the home to teach parents how to do in-home injections. So basically, they have a medication and there's children with a specific diagnosis who need to get daily shots. And these are sometimes pediatric nurses, sometimes they have a dietitian background, but just clinicians who go into the home and teach parents how to give their child a shot. I'm sure that you are thinking exactly what I was thinking was that's probably not an easy job for them to do. So I actually broke that training up into two different ones. I did a virtual workshop for them first, where we met over Zoom for about an hour and 15 minutes, 2 weeks prior to meeting them in person. And this was actually a follow-up virtual workshop that I had done with them in a year prior. So they had a little bit of a refresher about what child life services are and all that good stuff. But for this group, we really went into ages 2 to 7 and what is the best way to approach a family when you're having to teach a parent how to give their child a shot. I think regardless of what the procedure is, if it's shots or giving medicine, whenever the parent has to move from like caregiver to clinician role, it is always really tricky. It comes with a lot of emotions, a lot of feelings, a lot of pressure. And, you know, I have had a lot of medical parents tell me it's honestly nice when we go to the hospital because they take over that like caregiving job and you just get to be mom and dad. So I totally just feel for these families who are having to bring medical stuff like that into their home, especially when it's the first time or the first time that it's happening. So it was really an incredible workshop. Being live with clinicians who are just so eager to learn was really cool. By the end, like these clinicians were doing psychosocial assessments. They were thinking about family systems. They were building rapport with kids, and they were thinking about cultural differences in families. And it was just so amazing to see. And I just love a company that is like, hey, the way our clinicians talk to families matter and can really impact the success of not only, you know, the drug, but success of the whole, you know, child's outcome. So anyway, that's what I was doing. And I also had the opportunity to meet with a couple of child life specialist teams in two really different settings. One was a group at Advocate Children's Hospital, and they were incredible. There was a group that I was meeting with in person, and then about 10 other people from another campus joining on Zoom. And we just got to talk and share a little bit. And then I met with a community center, which is a cancer wellness center, and got to meet Alyssa, who is a Child Life Circle member, but also a child life specialist in the community setting, really providing services to families head on after they leave the hospital and going on and on. So loved meeting and learning about all that she was doing. Okay. So sorry, I did not mean to ramble on and share all of that with you, but some of you may be interested about what child life looks like from kind of an out of the hospital perspective. And I'm just so happy to share that. Okay. So then we took a huge leap of faith to go to the American Academy of Pediatrics conference. Y'all, there were over 13,000 registrants at this conference, and we met people globally from all over the world. Physicians, pediatricians, those who are in private practice, those who work in the hospital, emergency medicine, hospitalists, ortho, one adolescent medicine doctor, another doctor who works with adults with special needs. And I am not kidding when I tell you that every single physician who had worked with child life before came up and said, "Oh my gosh, we love child life. We need more of them." And I guess I wasn't really prepared for that. I had a bunch of imposter syndrome coming up to the day. Like, even the day before, I literally had butterflies in my belly being like, are we going to be the laughing stock of this conference? Like, little old child life here with a bunch of pediatricians and physicians at a world-class conference. And I could not have felt more welcomed. On my team, I was there. I made my brother come along with me. He is in marketing. And I asked him as a good favor, as a sister, would you please come with me? So he helped me a ton. We had a couple representatives from Inova, which is one of our Child Life On Call app customers. And then Annie, who provides virtual services for us. She lives in North Carolina. She came up to join us too. So it was like a little mighty team. And the first day was overwhelming, to say the least. We had hundreds of people come up to our booth. And let me paint this picture for you. This is a huge warehouse where literally Johnson & Johnson, Pampers, Merck, like the biggest names in pharmacology, in pediatrics, literally in children's health were there. And their booths were not, I say booth, it wasn't a booth. Like, they could have filled up 2 huge conference rooms with some of the way that their exhibits looked. And then way back in the very last row in the middle, because we were one of the last people to join this conference, was Child Life On Call. But of course, we bring the fun stuff, right? So our friends at Smile Makers provided us with the most fun new Band-Aids they have. They look like little game controllers. They're adorable. We got so many new sensory toys, medical play dolls. Of course, we brought a bubble machine. And we just had so many people come up, not just like literally at first glance. They would either see Child Life and go, "Oh my gosh, I love Child Life," or they'd go, "What's that?" And they wanted to learn. So we had the flavored tongue depressors that Smile Makers have, and everybody loved that. So it was really cool. The traffic, though, by our booth was just hundreds and hundreds of people. And we all had to get really good and comfortable fast with like explaining not only what Child Life On Call does, but child life outside of the hospital, and what does that look like, and what does Child Life offer. So I thought I'd share with you some of the takeaways that I got from the pediatricians and the physicians that I talked with in regards to Child Life. I want to take a short break to share something that we've been working on. If you are a Child Life specialist and you are not in the Child Life Circle community, I want to invite you personally to come join us. It is a group of about 120 child life specialists, and it's like an online community. It's through a platform called Circle. So it's an app on your phone, it's on the desktop, but it's basically one big love fest where we share resources, ask questions, share wins, share losses as child life specialists. But it also is an opportunity to get 2 PDUs per month, which basically means that you are getting 2 PDUs for like less than $10 per PDU. And I don't know if there is a better price out there other than free. And also we share free PDUs with each other too. But you are guaranteed 2 PDUs per month while you are in the circle. And they cover everything from, just parent perspectives, caregiver perspectives. We've talked about stress in the hospital. We've talked about music in the hospital. We've had organizations come and present in a webinar format and attach research and theory to all of it. And it's really actually actionable PDUs. And we want you to be in the circle with us. So go ahead and head to childlifeoncall.com/childlifecircle, and you will see all of the good things that we have going on there. And we just really want for you to come join us and be a part of our little community. We also offer virtual clinical supervision. So if you are feeling like you are in the need of a boost in your career, and again, I would just say like a warm hug from our clinical supervisors and team members who are there to support you, we want you to join. And if at all we can get your hospital or healthcare institution or company to pay for your membership, we make that happen as much as we can. We have many members of our circle who are there, and it's completely paid for by their hospital. Okay, I hope to see you there. Come join us. Okay, so back to the AAP conference. So we're in DC, which is really nice because I'm comfortable there. I lived there for many years. I don't know, it was just kind of nice to be in a familiar place. And number one, the key takeaway was physicians, pediatricians miss having access to child life specialists like they had in their hospital during residency. So most pediatricians who have gone on to work in different areas, what they say and what they feel like is they lose access to child life. The ER physicians, not as much. They, get to see child life pretty frequently if they're in a large children's hospitals, but otherwise they just feel like they miss child life. And that was what came up time and time again and was just really the opening that a lot of providers said to us. The second thing that I really noticed was that there is a clear gap in being able to adequately prepare children for, maybe typical but essential procedures that happen in not a children's hospital. So vaccinations, blood draws, stool samples, caths, IM injection, sub-Q, all of these things that may happen outside of the hospital environment. Providers are still feeling like families still need help in those areas, and they don't necessarily have the resources to prepare them and ease their fears and walk alongside families like they want to. And they wish they had more child life for that. The third takeaway that I want to share with you is that a lot of physicians and providers came up and said, we have so many children and families in our practice who are dealing with sensory needs or complex medical needs, and we just know that child life could make such a difference for them. And how do we do that? So we did a lot of brainstorming there, a lot of chatting, and it was really fabulous for us to see providers recognize not only that families have this really special and important need, but child life specialists could be a gap filler for them. And then the fourth takeaway I want to share with you is that they really miss child life being available for staff training. So what I heard was like, oh, I wish that we could just get a quick in-service for our staff for child life. And, child life practices, strategies, tips make such a difference. Like they helped me be the doctor I am today. And I wish my staff had access to that. So those are the really beautiful conversations that I had with so many providers. And gosh, it was just such an amazing time to feel validated in some of the challenges and gaps that we see, to feel, I don't want to say like loved comes to words, but just so needed in healthcare. And as child life specialists, I think a lot of times we can say like, does my job even matter? Am I valued? And overwhelmingly, yes, like that is what I heard provider after provider say. So at Child Life on Call, we are doing a lot of things to help with these solutions. And it's just such an honor to be, it's an honor, it's exciting, scary, risky to be on this side of it, growing a company that is looking to tackle and get more access for families outside of the hospital. It's something we've always known as Child Life. Like we don't get to go home with families. We don't see them before they get to the hospital. What happens when they go outpatient? Or they're just, following up their pediatricians or specialists that don't have child life. So we're so excited to be filling that gap. And I just wanted to share that with you. So Thank you so much for being here, child life specialists, parents, clinicians, whoever you are. And please follow us on Instagram, on LinkedIn. We do a lot of posting on there. And then, of course, our weekly podcasts, which we will get back to our parent stories starting next week. We have a fabulous guest, Keely, and I have just fallen in love with her and her family. And yeah, just so grateful that you're here, and I will see you guys soon. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists. Parents, we've got a starter kit for you. And clinicians, we even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.